In the next few videos, we will talk about bed mobility exercises for patients with spinal cord injury. These exercises are very essential for those patients, either as for their own value, like for example rolling, they need to perform rolling, or they need them, for example, for transitioning as part of bed mobility to help them with skin inspection for skin protection and pressure ulcers inspection. So they need them for different purposes. When doing these exercises, there are a variety of ways to teach patients how to do these skills. We will try to learn the different activities and keep in mind, for example, that we have a patient with complete injury. But if the patient has incomplete injury, then maybe we could modify the techniques. Or for example, depending on different levels of injury, we definitely need to modify the techniques as well. So that's one thing to keep in mind. The other thing is the environment. So we will start on the mat, and this is because the surface of the mat is stable, is big, so the patient can move freely. But we definitely need to keep in mind that we need to progress those skills to different surfaces, like for example a high bed or a narrow bed. For example, for rolling, we need to do it with under bed covers. For the transfer, we need to do it with different surface heights or different angles, for example. So we need to modify the environment we do these exercises in, because we need to accommodate what the patient has in their real life. The other thing we might need to consider is the use of adaptive equipment. Usually, we try not to use adaptive equipment and teach the patient to be independent in doing the task so they can do it on their own. But if based on the patient's situation, we know that they will not be able to do the specific skill without adaptive equipment, then we need to provide the adaptive equipment for them and train them to use them. Why is that? Because the first priority is for the patient to perform the task and be independent. If we could achieve it without adaptive equipment, that's fine. But if not, then we use the adaptive equipment to achieve independence, because independence is our primary goal. Now, the first task we teach our patients is rolling. And rolling, we've discussed this previously when we were discussing the different functional activities. There's nothing new here. We need to keep in mind that the ability to do it will depend on the patient's level, and that we need to practice on different surfaces, especially remembering that we need to do it on a narrow bed and under covers like we just mentioned now. Other than that, rolling is the same. For the adaptive equipment, patients might need, for example, bed rails or overhead trapeze. They might need these equipment to help them be independent in doing the rolling activity. Usually rolling is a good starting point. After we accomplish it, we move to other tasks.